Friends, today we are going to present a case of dengue fever to you. What all do we see on the ultrasound in dengue fever? She is a 17-year-old girl who has been having repeated vomiting for last 5 days. She had a small bout of fever about 5 days back, and since then she has been having some rash on the face. You can see her face. The rash is not very conspicuous, but the vomiting is marked and there are no other symptoms. She has been passing very small amount of urine since last 3 days because of repeated vomitings. Let us do her ultrasound. You can see that the gallbladder is edematous, the liver is enlarged, and the gallbladder wall shows marked edema. And there is fluid around in the gallbladder fossa, and this is suggestive of hepatitis, and the fluid around the gallbladder fossa is a hallmark of dengue hemorrhagic fever. When the fluid leak starts from the vessels and starts accumulating in the serous cavities, so there can be fluid in the peritoneum called as ascites, or there can be fluid in the pleural cavities called as pleural effusion, or they can be at times fluid in the pericardial cavity also. Here you can see there is fluid around around the gallbladder fossa, and the gallbladder wall thickness is increased. It is 7.83 millimeters. Normally the gallbladder wall thickness is less than 3 millimeters, but here the muscular layer of the gallbladder is increased in size and increased in thickness. And you see that inside the gallbladder, the inner mucosal layer of the gallbladder is absolutely smooth. It is the muscular layer which is edematous, and around in the gallbladder you see that there is free fluid over here. And this is a case of polyserositis, or ascites, at least to say that it is a case of ascites with. And here you can see that there is free fluid in the Morrison's pouch. This is the kidney, and this is the liver, and there is small streak of fluid in the Morrison's pouch, which suggests that this is a case of ascites. And here incidentally the patient has a small stone also, but as you can see the Morrison's pouch where there is some fluid is seen. And you see the Morrison's pouch again. This is the free fluid in the Morrison's pouch, and there is free fluid around here in the lower part of the liver also. And now we go on down below into the abdomen, and we find that there is free fluid in the abdomen. You can see that this is the uterus, and this is the ovary, and this is the adnexa, and there is free fluid around here. And if I tilt my probe down below, I can see that this is the urinary bladder. Previously it was giving the impression that this is the urinary bladder. This is not the urinary, this is the down below is the urinary bladder, and here this is the free fluid in the abdomen. And you can see that the organs of the abdomen are floating into the free fluid, and you can see that this is the uterus, and this is the ovary, and they are floating into the abdomen free fluid. And now, as I suggested to you, that you should look for the effusion in the pleural cavities. We are going to look for the effusion in the pleural cavities. This is the chest being seen in the intercostal space, and down below we see that there is fluid around the liver. And on the left hand side we find that there is free fluid around. There is no free fluid in the cavity, but there is some fluid around the spleen. There is some fluid around the spleen, but there is no free fluid in the costophonic angle, so there is no pleural effusion. So, and now try to look for the heart. You can see that this is the heart, and there is no significant pericardial effusion. So this is a case of dengue fever with ascites. We are saying ascites because we are saying it is dengue fever because there is, though there is fluid in the around the gallbladder fossa, but there is no probe tenderness, and patient has symptoms suggestive of dengue fever. Her platelet count was found to be 80,000, and her dengue serology was found to be positive. Thank you very much. Please like our videos, subscribe to our channel, and share it with maximum with your friends so that large more people can be benefited.